lab, they forget to remove this and put it on the patient, tighten it down, and then they pull that off. Or they just don't remove it until what you're doing when you're removing is you're actually kind of zeroing out with no pressure being applied to this manometer. And so it is important that you actually do it before, and even just by putting it on the patient and cinching it down, you're gonna put some pressure against that manometer, okay? So always make sure you pull that out. I'll also wanna tighten down, just like for a blood pressure, doing a blood pressure. All right? There's little clamp and little teeth right here. That's where we're gonna feed the belt through, okay? You have to push down, keep it pushed down to feed the belt through. I like to go in an angle. Yeah, no, don't help me. Thank you though. You're not gonna have help most of the time. You want to take the center of your little star, so to speak, and you want to place it just a teeny bit above where you think that puncture site was. Just like if I was going to I had held manual pressure. Okay? I'm not going to cinch this down tight yet because my ultimate goal is to have this arch straight across, not real cocked this way or cocked this way. I want it straight across. I do want it nice and firm. I don't want it cinched down so tight that it's cutting into the patient. I'm going to feed in my other side. I can see through, which is I'm positioning where I want my pressure. Just pushing, cinching, pushing and cinching. Again, kind of feel how that, I want all of you to just kind of tap on it and feel how tight I've got that. Not cutting down into the patient, but not too loose either. Okay. Once we get it to where we want it, then we're going to pull up on these little clamps. That's going to kind of secure it, cinch it, make sure it's not going to slide out.
So they're like jigsaw teeth? Is that kind of,
okay. Now, this is the point where I told you some people will just leave it like that for that post-hemostasis. If that's what your preceptor tells you to do and they feel comfortable with that, it is applying some topical pressure, okay? Your best practice is really to try to push in that 20 to 40 millimeters of mercury. It just does direct that center of this dome a little more on the artery, okay? Obviously here, we're not gonna see, but normally we would just, and you can actually see it inflating. All right, when we're practicing or when I'm testing you and you're just gonna, a couple little squeezes and I'll say, okay, you've got enough in there. I will be asking you questions, where do you normally put it? So you'll tell me 20 to 40 millimeters of mercury. Okay, the next thing you wanna do is check your pulses. You wanna come down and make sure that we have good pulses. If we're good, that's fine. In that scenario where, this patient's blood pressure is 180 over 100, again, I said I might just put a little bit more if I'm feeling concerned that maybe they're going to bleed. If they're much thicker, put a little bit more, maybe 60 millimeters of mercury. Feel a pulse. Most of the time, you're going to still feel a good pulse. Last step I want to do is lock my tubing. This is going to be sitting down here by the patient. They could get a hold of it, unscrew, and let that pressure out. If this is locked, even if I unscrew it, nothing comes out, okay? It is locked. I'm gonna leave the patient, tell them not to sit up, roll over, don't bend this leg, Don't raise your head. If you feel anything warm, wet, sticky run down your leg, call for the nurse right away. And then, of course, we would give a report to the nurse. An order should be in for the FemoStop. We may have to chart what we've done in the computer system. And some places, they'll actually put a little restraint on their ankle and tie them to the bed. Just make sure that if we are tying them to the bed, we never tie them to the rails. We tie them to somewhere on the bed, or we could actually, yeah, on the frame. Just so that if they're raising or lowering the rails, which we should leave our patient with both. We have been leaving this patient very vulnerable to a fall. So when we leave, go ahead and pull up your side rails over there. When we leave our patients, pull out and then pull up. And it's either one way or the other that you pull up.
It's like a round the house motion.